Welcome to another episode of Empower Hour, the podcast dedicated to sharing best practices and insights for nonprofit leaders. I'm your host, and today I am thrilled to welcome an extraordinary leader in the humanitarian space. Our guest today is Dr. Douglas Jackson. He's the president and CEO of Project C.U.R.E, one of America's most impactful global health organizations. Under his leadership, Project C.U.R.E delivers approximately 4 semi-truck loads of donated medical supplies and equipment weekly to people worldwide. Since 1987, they've reached hospitals and clinics in over 135 countries and have been recognized by Forbes as one of the top 20 charities in America. That is impressive. Mm-hmm. Dr. Jackson brings a unique blend of academic excellence and real-world leadership to our conversation. His experience includes roles as a university provost, executive director of a business center, and legal counsel for Berkshire Hathaway Company. Beyond his work with Project C.U.R.E, Dr. Jackson serves on multiple prestigious boards, including Interaction and the World Trade Center Denver. He's been honored with the Lifetime Achievement Award in Healthcare from the American Red Cross and the Princess Prize for Innovative Philanthropy. This one's a big one, guys. I'm still in awe over this. From Prince Albert of Monaco, and is a fellow of the Aspen Institute. Today, Dr. Jackson will share insights from mobilizing over 25,000 volunteers annually, managing global logistics operations, and building an organization consistently awarded top ratings from GuideStar and Charity Navigator. Please join me in welcoming Dr. Douglas Jackson. Woo! Thank you for being here.
Thank you. Thank you very much for that very kind welcome.
Well, you are such an impressive leader. I was telling Micah earlier, I said, if you weren't so nice, I would be incredibly intimidated by you.
That's kind. Thank you.
Thank you for joining today. Yeah. I'd really love for you to start kind of talking about Project C.U.R.E and what you do, because it's such a big mission.
Thank you. Yeah, Project C.U.R.E, it's interesting because it's a family project, and it was started by my mom and dad. My dad was a very successful real estate developer. He developed most of Winter Park and a little bit of Vail, Colorado, and made a lot of money, and then figured out that you can be rich and not happy. Money doesn't make you happy. It just amplifies whatever is already inside you, right? Mm-hmm. And so he and my mom decided to give their money away, start a foundation, and that was the genesis of Project C.U.R.E. He was down doing economic consulting in Brazil, and his interpreter was a little medical student, and Lorena's mama was a doctor, and so they took him to a clinic in a favela, which is like a slum in Brazil, and it was just an old house, and this was primary health care for 300,000 people, and there wasn't anything in it. And it just kind of tore my dad's heart out. So he came back to Denver. He had a buddy named Greg Lowe, and Greg and his partner Pete owned a medical wholesale company, and they filled up my mom and dad's garage with donated medical supplies, and my parents paid to ship that down to Brazil, and that was 1987. So that's how we got started. Today, fast forward, we're running warehouses in 7 cities across the United States, soon to be Dallas, Texas, which would be number 8, probably Los Angeles after that, which would be number 9. These are 50,000 square foot warehouses, so they're huge.
Wow.
And they're staffed by volunteers. When I started, we had about 12 volunteers. The top line of Project C.U.R.E was about $100,000, including GIK, gift in kind. And today we're edging up on about $100 million of stuff that we're doing. We're running 7 50,000 square foot warehouses. So it's Denver, Phoenix, Nashville, Houston, Chicago, Philadelphia. And during COVID, we opened Kansas City. And anyway, we go to hospitals, manufacturers, wholesalers, and we collect everything from catheters to CAT scans. We put it in these big 40-foot cargo containers. You see them running down the road, you think it's a semi-truck trailer. And we ship them off to developing countries where people make less than $5 a day. They'll work 12 hours to get it. They're not sloughing. Places, there's parts of Ethiopia, for example, they'll work 12 hours a day and they make $100 a year. And these people just can't afford health care. And so, moms die in labor. Dads can't work because they got an infection and a cut on their leg and no way to treat it. And so we're coming in providing all the supplies and equipment for the doctors to do healthcare.
Wow, that's so incredible. Have you really assessed how many lives you've saved?
You know, it's just interesting. Project C.U.R.E does a needs assessment before we ship. And what that means is somebody from Project C.U.R.E goes to that location, and we meet with the doctors and nurses. It takes about 4 hours to do one of these. There's 18 pages of questions. And based on that, we look at how many people we could calculate that we touched by that. So the way that we calculate it is we ask questions about the catchment area. In other words, how many people in this community depend on that particular hospital for healthcare? And then we ask another question, which is different. How many people from that community actually came to that hospital that year? And then you got one that breaks it down even further. How many people actually went up and laid in a bed overnight? Those are hospitalized patients, right? And how many babies are born? What's your cesarean rate? We ask all those questions. So if you take the number of patients that actually came to the hospital, add them all up, divide by the number of containers, it's rough math, but it sort of gives you an idea. We think we touch between 30 and 40,000 people per container.
Oh, my goodness.
Because a lot of these hospitals, you know, they'll have 6, 8, 10,000 people come to the hospital in a month, especially the big ones. And so it's a lot of folks. It's a lot of folks.
Do these hospitals charge the families anything?
Some do. Some do. Some are, you know, government-run hospitals. Most are government-run hospitals. Some will have a fee that they might pay, like a copay. Some don't. The problem that we run into a lot of times is you might go 6, 8 months and the nurses and doctors don't get paid.
Wow.
So they quit, or they go down the road and they start a private practice. And so, you know, the doctor is only there Tuesdays and Thursdays because Monday, Wednesday, Friday, he's running a private clinic down the street. So if you have money, then you go to the private clinic. If you don't have money, you go to the free hospital. Right, and it really bifurcates the system. So anyway, it's different, but yeah.
Wow, yeah, that's impressive. I'm so moved that your parents were able to pull off something so remarkable as this and have the heart to serve, and then obviously good parents that encourage their son to give back too. And so, man, that was heartwarming. I love that.
Thank you.
You know, when I think about the magnitude of what you do and, you know, all the containers you get out of medical supplies in over 135 countries,
right?
You must have some really good organizational systems to manage logistics at that scale. Could you explain a little bit and maybe some lessons learned?
Yeah, we organize Project C.U.R.E. I call it more like Starbucks than Burger King. And here's what I mean by that. If you're talking about the good work that's done by Habitat or the United Way or Goodwill, the way that they're structured is every Goodwill will have a local office, right? And they've got an executive director or president, and then they have a COO and a CIO and a CFO, and they have to get their own board and they have to staff. For us, that system doesn't work very well because logistics, particularly international logistics, is really, really difficult. Figuring out how to get things into Nigeria, into Kenya, into Mexico, into Cambodia, that's hard. So there was that reason. And then the quality control issue, you know, Habitat doesn't have to worry about whether or not the local chapter here is building a really great house because you have a building inspector that will come and make sure that the plumbing is right, the electrical is right.
Valid, yeah.
We have to know that every one of those containers is the same quality, whether they're getting that container from Kansas City or Nashville, Tennessee. So what we decided to do was to organize more like Starbucks. Starbucks has company-owned stores. That's it. And we are company-owned stores, as opposed to a franchise where you could start your own Habitat or whatever around the country, right? Well, what that allowed us to do was to really specialize on that hard part. And that hard part is the shipping and logistics. It's also hard to do the needs assessments, and it's really hard to do the planning. So we centralized those functions. We also centralized our website. We centralized our audits, which saved us some money too. So when we scale, we only have 2 people that we hire in each one of those cities. It's the executive director, whose job it is to go out in the community and raise money, and the operations director, whose job it is to stay in the warehouse and make sure that the volunteers are happy and the containers are getting loaded. And that's it. So we can scale pretty fast because all the other stuff is done back office, right? And so that was our sort of structural thought about how can you scale and how can you do the really difficult, very, very difficult things like international customs and do it at scale and do it with, we'll have 30-some thousand volunteers this year. How do you do that with volunteers? So that's the way that we did it.
Yeah, speaking of the massive amount of volunteers you have, what strategies do you have to recruit and retain them and get them doing what you need them to do?
Yeah, that's really I guess if I was to say, what's your secret sauce, it would probably be volunteers. We had a big warehouse out at the old Stapleton International Airport here in Denver, and it was an airplane hangar. And Mayor Webb had let us use it, and Stephanie Foote, who was deputy mayor, took us out there and gave us the keys, said, you guys can use it. Well, it got really, really, really big, and it was all full of stuff, and that was about the time that the city decided to redevelop Stapleton, so they served us eviction notice and bulldozed the building. I went to see one of my board members who was an old cowboy, and he had, and one time had owned a trucking company. And he said, son, for all the good you do for God and country, you're a trucking company, and you need to start thinking like a trucker. We got to get you trucking. And so we bought a big warehouse outside in Brighton, Colorado, because trucking companies buy big hubs outside the city where the dirt is cheap. Then I learned a very important lesson. Nobody drives to Brighton, Colorado. It's a long ways north. It takes 45 minutes to an hour to get up there, 45 minutes to an hour to get back. So if I wanted to take a donor up there, it's an all-day excursion for them. They probably don't want to do it. Volunteers don't want to drive that far out of town. We're not in the warehouse business. We're not in the trucking business. We're in the people business. Mm-hmm. So when we sold that warehouse and we moved our warehouse down to Centennial, we plunked it down right in the middle of, a neighborhood. We got a shopping mall less than a mile away, and we've got an IKEA store. We can walk up to Maggiano's. We're right in the middle of the hub of everything. And our volunteers went from in the hundreds to in the thousands. And it taught me that lesson that you have to center your entire organization around those people. Mm-hmm. So we have a rule, no copy, no coffee. And what that means is we're not going to take a volunteer and just dole out all the stuff that we don't want to do. They are central. So our staff exists to serve the volunteers, not the other way around.
Oh, I love that. That is so powerful. And yeah, I think that a lot of nonprofits don't leverage volunteers enough, and they really, really should. And so how are you able to retain them?
They have first of all, if they're there, it's because they care, right? People don't show up to places where they don't care. So let's start with that first. And this is the one argument that I do get into with even my staff sometimes is don't tell me that somebody is more motivated just because you're giving them a paycheck. No. People are motivated because of what's in their heart, right? The problem with business sometimes is you give them a paycheck and you forget that you have to engage the heart with the paycheck. And I understand, we all need to pay our mortgage and put gas in the car and stuff. So volunteering on a large scale, and I'm talking like 20, 30, 40 hours a week, now you're talking about people who have either retired or married well or divorced well or whatever, and they've got the opportunity to just give a lot of time. But most people will come in and they'll give 2 to 3 hours at a time, and that's a great thing. So then you have to build the scale so that those people come for 2 hours and have a meaningful experience and want to come back. All of the people that can come longer, like 3 days a week, 2 days a week, mornings, whatever, those people then become the leaders of the other people. So we train those folks to be the leaders. And when you do that, remember, you can never separate responsibility and authority. So if you can make that person responsible for getting the trucks unloaded, then give them the authority to do it, right? And so we tell them, this warehouse belongs to you. We're going to walk through periodically and make sure it's all going okay. But, Dave, you're the guy in charge of loading the trucks. You figure out what stuff you want to put on first, how you want to get this done. And, Dave Truitt, who's on our team, has loaded, thousands of containers. He's been with us for over 20 years as a volunteer.
Wow.
Right? And his wife, Millie, has a section of the warehouse, and she owns that. And we just know that that's Dave and Millie. And we've got other people who own their piece of it. You got Bethany who owns a piece of it. And that becomes their part of the warehouse, and they own it. And Tyler's job, who's the paid staff, is to make sure that those people have what they need to run their warehouse, because now it's their warehouse, not ours.
Under your leadership, Project C.U.R.E has maintained top rankings from GuideStar and Charity Navigator. What financial management and transparency practices do you believe are most essential for nonprofits?
Well, I think, first of all, the only difference between nonprofits and for-profits is the fact that we don't pay tax. All the other rules apply. And that means that the first bit of attention that, whether it's the president, the CFO, somebody, the board, has to be paying attention to is the money. And we in nonprofit like to say, well, we're about the heart, we're about the soul, we're not really about the money. Well, guess what? If you don't watch the money, your heart and soul have no place to go, because you're going to go out of business. And so your revenue has to exceed your expenses, and it doesn't matter where you are. So you have to have an eagle eye on what's going on with those numbers, and that has to be priority number one. If you miss that one, nothing else matters. Now, once you get a good return, right, we call it a surplus. It's not a profit because we're nonprofits, or positive fund balance. There's that, right? But it's the money that you have at the end of the year. Then the board and the team get to decide, where do we want to deploy those assets, right? What do we want to do with that money? Do we want to use it to grow? This is one of those things that people on the outside don't really understand about nonprofits. If you go down to a bank and you say, hey, I got this really great this really great idea. Here's my idea on paper. Give me a loan. They're going to say, no, you're a nonprofit. We're not sure that you're going to have sufficient streams of revenue to repay the loan. I've heard this before. Say, well, wait a minute. If I was opening a restaurant, I have the same problem, but you'll give the restaurant guy a loan. Why don't you give me a loan, right? But they don't. You can't sell stock because technically a 501c3 nonprofit belongs to the general public. So how do you raise capital? And the answer is, that's the money you didn't spend this year. Mm-hmm. So what do you want to do? You want to buy another truck? Do you want to buy another warehouse? Do you buy a forklift? What do you do with that money? Do you expand a new city? Do we create, let's have a volunteer party. Let's buy T-shirts for all of the volunteers. That's an expenditure of your capital. And so you got to be really savvy about that. And then the rest of it is, you just need to let people know what you did with their money.
That's true. That's true. So what is your practice as far as reserve? How many months do you have in reserve?
It kind of depends. And the reason it depends is because we are very heavy on restricted assets, restricted giving. And this is the way that it works is, let's say here in Denver, we've got a big Ethiopian community. This is the diaspora that moved here from Ethiopia maybe 1 or 2 generations ago, first generation in the country. They get here, they do well, and one of the things that they want to do then is to give back to the local community. So they start fundraising, and they want to support the delivery of a container back into their community in Aksum or someplace like that, right? Oromi Estate, someplace. Those monies are all restricted. Okay, so we're sitting on a bunch of restricted money. All the money that people gave us to do Ukraine, we're still doing Ukraine. Mm-hmm. And so I've got some restricted money sitting in the account for that. Maybe a church takes on a project in Mexico. Well, that money is all restricted. So we carry if you looked at our balance sheet, we carry a pretty high amount of cash, but a lot of that cash is restricted to those projects. Then we have the unrestricted, and we carry a few months, probably 6 or 8 months of unrestricted money in our accounts just to make sure that things are going well. But I keep, every week, here's back to your question about transparency. Every week we publish a report that shows every deposit that came into the organization, and we give it to the entire staff.
Oh, wow. That's
and the
great.
Fundraisers look at it. They can see exactly how they did. We know what our burn rate is. In other words, we know how much minimum we need to bring in every week, right? And some weeks fluctuate. Some weeks, are great and it's 7 figures, and some weeks are lousy and it's 5 figures. If it gets less than that, I get really skittish. Mm-hmm. But there's no hiding in the weeds and then come up, at the end of the year and say, oh my God, we're, $2 million shortfall. Everybody knows week to week to week, and everybody knows who gave what and who brought in what. And, some of I've had people on the fundraising team that get really upset about that. It's like, well, why should the entire organization know that I'm hitting my numbers? It's because you're not hitting your numbers. Mm-hmm. And even though that guy's working in the warehouse as the operations director, his mortgage payment depends on your ability to hit the numbers. Those people that are in the warehouse packing those containers are counting on the fact that we have money to ship that container, and the people on the other side who are waiting for this, and you need to save their lives, well, guess whose that's responsibility is yours to raise the money. You got to raise the money. So if it's not working, we're going to be pretty transparent and expose that whole thing.
I love that. I think that would make people be better fundraisers, because there's the fun side of that too, where they get bragging rights when
you get to celebrate, and that's a very important thing, right? When somebody does something really well, either they get really good or they quit.
Yeah,
one of the two.
Yeah,
when we've had people, of course, they always get mad at me when they're not bringing the money in. I'm like, it's not my responsibility. You signed up for this. At some point, you sat across the desk, looked me in the eye, and told me you could do this job, and you're not doing the job. Why is that my fault? If you're the fundraiser, go raise money.
Yeah.
If you don't want to do it, go find something else to do.
Yeah, I definitely think, there's challenges with finding a good development person. Yeah. Honestly, that understands, that it's really about building relationships. It's not transactional, and when you get one, man, a good one, you don't let them go.
Right. Well, and there's different levels too. And this, people think about nonprofits and say, oh, well, I want to do fundraising for nonprofits. Well, if you're working for a hospital system, you're going to get paid a whole lot more than if you're working for somebody like Project C.U.R.E. Mm-hmm. Right? Which is great for the fundraiser if they can play at that level. Awesome. Makes it kind of hard for the rest of us to recruit. It's kind of like,
it does.
Well, maybe I should quit my job as the executive director and go to work for you.
That's so funny.
Right? No,
we need you. We need you right where you are. So don't get any ideas.
No, I'm not going anywhere.
Anyway, when talking about the fundraising piece of it, what do you find is the best way to fundraise that you've had the most luck with?
So we do an interesting thing. We've got 7 cities, right? So we've got fundraisers, executive directors in each of those cities. And like I said, their job is to go out and raise the money to ship the containers. So you're looking at a 7-figure target, right? But what I've never done is to say, well, there is a Project C.U.R.E. way, and you have to do a gala. Some people don't like to do galas. And to force that person to do a gala is frustrating for them, and you probably aren't going to get a decent return on it. So you say, well, what's your secret sauce? What's your core strength? And somebody might come and say, well, I really love doing major donor development work. Okay, let's lay out a plan for what that looks like. Somebody might come along and say, I do love galas, actually. I love really big galas. And so I'm going to sort of, bet on black and hope that this big thing comes through, but we're going to have 500 people, and we're going to raise all this money, and we're going to have country western music as entertainment, and we're going to do all of this stuff. And I think we can, maybe we can net $300,000-$400,000. Well, wouldn't that be nice, right? Some people really love, subscription. I had somebody that said, I don't want to do any regular sort of type fundraising. All I want to do is spend time in the community going to look for those projects. And so they would bring in a lot of folks, from Cameroon and, the Lost Boys of Sudan and all of these people who were in the diaspora in that community and who either came from someplace else here or they knew somebody and they really wanted to do that. So they were writing checks to support the Rohingya refugees in Bangladesh or whatever it was. So I just tell the fundraisers, you guys tell me what you're really good at. And whatever you're good at, then you create a system around that. I mean, that's your sweet spot. Mm-hmm. Why would you make Tiger Woods play the cello and you're not going to ask Yo-Yo Ma to play golf? If they're good at it, let them do it. And
yeah, if they're having results, and I love that you let them decide how to do it as long as they're doing it and doing it well.
Well, and that's the management side of it too, right? Is if you tell somebody to do something and you tell them in such a way that you are so prescriptive, then if it doesn't work, they point the finger at you and say, well, you told me how to do this and it's your fault because I never would have done it that way, but I had to do it the way that you told me. The flip side of that responsibility and the authority thing is, well, I gave you wide open latitude to decide to do whatever it was that you wanted to do, so it had better work.
Exactly.
Because now the planning is in your lap, and you decided that this is what you wanted to do. So if you're good at galas, be really good at galas. I'm not going to tell you how to do it, but don't come to me 6 weeks before the event and tell me I don't have any sponsors yet. That's not going to work.
Yeah. So, that is tough to get sponsors in this day and age right now. I think corporations have been cutting back on their sponsorship support. Are you seeing that as well?
Yeah, but I mean, for us, it's always hard because, there's a pretty sizable percentage of the population in Colorado that doesn't even have passports. They don't travel outside the country. If they do, they might go to Cancun, Mexico for a vacation, right? Or someplace like that. So to talk to them about a story of what's happening in a place called Timbuktu, Mali, there actually is a city called Timbuktu. It's in West Africa. Their eyes sort of glaze over. It's like, well, why would I want to do that, right? So it's hard for Project C.U.R.E. because for us, we have to find people in this community who understand what's going on internationally and care enough to actually get out a checkbook. Mm-hmm. For major corporations, what they're really looking for is that's an investment of marketing dollars for them. They love the charity, and that's great, and they could spend it on radio advertising. They don't, so kudos to them. Hats off to do something to support a charity. But they're also looking at that, and they're saying, who are we getting in front of? In other words, what's our target audience? We went to a local bank, and we presented something for our young professionals board, and the person said, so give me the psychodemographic of this audience, right? And I said, okay, these are really smart young people from the ages of 25 to 40 and da-da-da-da-da. And he says, I'm not interested. Now, if you could put me in front of your retired volunteers, we could have a different conversation because here's the clientele that we would like to get in front of at your event. And I thought, well, that's smart, interesting, right?
Yeah,
but it's not because of a big charitable thing. I mean, I'm not saying there's not charity involved. There's a huge heart.
Yeah.
Otherwise, like I said, they'd spend all their money in radio advertising, or hiring people on Instagram or something like that, influencers. But you still have to make it smart. Mm-hmm. Why is it that it would matter to these folks to get in front? And I'll tell you who's really good at it. Right? Is like Subaru. Well, what does Subaru know about people who drive Subarus? Well, we like to be out in the woods. So let's support a charity that plants trees. Well, that makes all the sense in the world, right? They're charitable, but they also know that they want to look good to people who are probably likely going to buy Subarus.
Yep.
The same thing with Tom's, same thing with, everybody else, Ben and Jerry's, right? Mm-hmm. Who is it that was their target audience? Different than Haagen-Dazs.
Yeah, I mean, I think the same goes for especially major donors, right? Is that they might be passionate because it seems as though you've got a lot of stuff. You've got C.U.R.E. cargo, I think C.U.R.E. clinics, training programs, C.U.R.E. kits, all of that. And maybe they have a certain passion for one area.
Right.
Right.
Yeah, we did a little exercise early on in my tenure here with a big ad agency called Weber Shandwick. And we were working on creating our brand. And one of the things that we decided to do for our brand was to alliterate. So you have C.U.R.E. Cargo is our big cargo containers, right? And we have C.U.R.E. clinics, and that's where we go out and it's like Doctors Without Borders on a 10-day period of time.
Oh, wow.
Where we take doctors and nurses and we actually go to the places where we just shipped a container and we sit side to side with the doctors and nurses there and treat patients together, right?
I had no idea you did that. That is
Then
so
they
great.
ask about, well, can you train us to do, okay, so let's just do, we'll call it C.U.R.E. College. So we've got programs under C.U.R.E. College where we're teaching people, nurses and midwives and birthing attendants, basically how to save the life of a baby. You got 60 seconds once that baby's born to get it breathing, warmed up. Crying babies are happy babies. So, but a lot of places around the world, they don't really know how to do that. So a baby is born with apnea. They're not breathing. That midwife thinks that baby is stillborn and they just put it on a shelf and go back to treat the mother. Well, you had 60 seconds to save that baby, and then you can still save the mom. So we go and we teach that, helping babies breathe and essential care for every newborn and essential care for every mother and, hemorrhage, how do you treat hemorrhage? So we'll go in with 2 or 3 people and we do that. So we call that C.U.R.E. College. And then we have C.U.R.E. kits, and those are the 50-pound bags of medical supplies that a doctor going on a mission or a nurse going on a mission would take. Anyway, it's been kind of funny. Our volunteers are our C.U.R.E. Corps.
Oh, I love that.
Right. And my kids are Caitlin, Kendall, Caroline. So anyway, but that was part of our branding strategy was, make that like that. So it's catchy to the ear. And that's just sort of part of our thing. We're very red. All of our logos, our T-shirts and everything are bright red and everything's alliterated.
That's fun. Now, what is the C.U.R.E.? You put periods after each of those.
So that's the Commission on Urgent Relief and Equipment. So the relief is the Band-Aids and the gauze and the gloves and needles and syringes, and then the equipment is the X-ray machines and the ultrasounds and patient monitors and ventilators and all that kind of stuff.
Do you get a lot of in-kind donations of medical supplies?
Tons, literally tons.
Really, like hospitals and manufacturers?
So we're working with big manufacturers like Stryker. They've been huge sponsors and supporters of ours. Baxter, who bought Hill-Rom, who bought Welsh Allen.
Yep, huge.
Lots and lots of amalgamation, conglomeration of big companies now. And then we're working with HCA. We work with Intermountain Health here in Denver, a lot of different places like that. Almost every hospital in the state of Colorado donates to Project C.U.R.E. at some point, which is neat. Certainly all of them up and down the Front Range.
Yeah.
And then, there's wholesale suppliers that will give to us. Somebody ends up with a whole bunch of gloves. Kind of a fun story. After COVID was over, we got a call from Stryker, and they said, hey, we manufactured these beds for COVID. And this is back when we thought that all of the shopping malls and convention centers were going to be turned into hospitals, remember? Mm-hmm. And so they said, we've got these beds. They're 11 inches off the ground, so they don't need side rails. You don't have to worry about people rolling out of bed at 11 inches. They have wheels. They have a hard pan so you can do compressions. They've got a headboard, a footboard, an IV pole, and a brand new mattress. And they've never been assembled yet, so they're still in a box.
Great.
Would you be interested? And I said, I'm absolutely interested. They said, well, they're manual, right? They're not electric. I said, a lot of places we work doesn't have electricity. So yeah, that would be great. Let's talk about that. How many do you have? Well, it turns out we got almost 30,000 beds.
Wow.
And we have put those in all over the world. We're out of them. I mean, I wish we could find more, but we're out of. Barnes Jewish Hospital in St. Louis the other day did a bed swap, and we ended up with like 700 electric beds, which are, a new electric bed's $35,000, $40,000.
Yeah.
So anyway, a lot of those folks, and that was, a manufacturer coming together with a hospital and creating some surplus for us.
So do you have to purchase some medical supplies as well, or is it all donated?
We purchased a lot of stuff going into Ukraine because they were looking for things like hemostatic bandages and tourniquets and things that we just don't use a whole lot of here in the United States. We don't need to. But so we were actually buying some of that product and shipping that. We will buy things like transformers because you got to step down the power when you get to these different places. We'll buy repair parts, batteries, things like that. But the equipment itself and all of the consumable supplies is donated.
Oh, that's outstanding. I imagine shipping is very expensive.
Shipping is a lot. And, you don't think about every time the fuel gets more expensive, so does our charity work. When the Houthi rebels start attacking ships in the Red Sea and everybody stops going through the Suez Canal and goes down around the Horn of Africa, that adds weeks of time and thousands of dollars. If you have a problem like a couple of years ago, we had the war in Tigray in the northern part of Ethiopia. Well, the port of Djibouti serves that part of Africa. If there's war going on the roads, you can't get your containers through. So getting anything into the southern part of Ethiopia wasn't going to happen for a while. So all of those things you think about, and then just about the time that you think you got it all figured out, then the government of Kenya changes, the government of Mexico changes, and you start all over. It's like, okay, let's start negotiating again. And some days it just feels like Groundhog Day,
Yeah, I got to imagine. Yeah, it definitely must be a beast of an organization to run. You got to have a lot of tenacity. How do you not burn out?
Well, I think everybody talks about work-life balance. I call it work-life integration because there's weekends you're working and, sometimes you would just want to take off Friday afternoon and go skiing. So I think that's part of it. You do burn out a little bit. That's part of it too. You see in what we do, you just see a lot of sadness, things that are just
Exactly.
Gaza, right? I get the war. I understand what happened in October. But I also know that there's a lot of people who are innocent people who have suffered. They don't have food. They don't have water. They've been injured. There's no health care. It's just sad. It's sad what's going on in Ukraine. It's sad what's happening in Sudan, in North Sudan right now, the northern part. They figure, you're talking tens of thousands of people who have been killed. Tell me somebody who has seen that on the front page of any paper in this town. We didn't even talk about it. But that's where Project C.U.R.E. is, and we're right in the middle of all of that every day. So if you're not careful, it can get really overwhelming because it's pretty sad. So you focus on the wins and say, hey, that was a really cool story. We've got a little newsletter coming out, and one of the stories we're going to tell is we had one of those clinic teams in Africa doing clinic work, and a mom who brought her daughter in. Her daughter had cerebral palsy, and one of the reasons that children, babies, are born with cerebral palsy there, it's just a brain defect, right? Is because they get stuck in the birth canal and they're stuck there without oxygen. And so anyway, this mom brings her daughter in, and she's been carrying this daughter who's not a baby anymore, carrying this daughter on her back every time they went someplace. Well, daughter's growing up, and it's getting heavy, and she's tired of carrying it. So she just comes to the hospital where our team was working to get a checkup and to talk about her daughter. Turns out Project C.U.R.E. had shipped a container about 6 months before, and what do you know was on that container but a wheelchair? It completely revolutionized that entire woman's life.
Wow.
And her baby, right? Her child. Anyway, those are the kind of things that you look at and you say, well, that was a win. Let's focus on that. And so we're real careful when those stories come through to pass those around to the staff and to all of our key volunteers and to keep telling the story about, in that hospital, that mom came in for a cesarean section 6 weeks before. They didn't have an operating table. They didn't have any supplies. They didn't have anesthesia, oxygen, anything. And thanks to Project C.U.R.E, that was all in that container. And that mom came and delivered those babies and went home. So those are the kind of stories that we like to tell, because that's what keeps you motivated and that's what keeps you focused on in the middle of all the other noise.
Yeah, and I mean, especially staff that go into nonprofit work. I mean, like you said, you could go somewhere else and get paid more, but they're in it because they're passionate.
Right.
But passionate people can burn out if they don't have boundaries, right? And especially CEOs.
Yep.
They carry the weight of the world on their shoulders, and so I love the storytelling aspect and the fact that you're including those stories with your volunteers and with your staff, because then those stories are ones that they can share, for future donations as well. And storytelling is so important with fundraising, especially when, like you're saying, if they haven't been to Ethiopia. Those stories are really, really important. Do you have like a story bank where you keep all of those, or?
Yeah. And they're, that's the challenge. First of all, is to get people to send the stories to you, right? Because we're not always in the field when those containers show up. Right. And so how do you emphasize to your partners that this is really important for you to take pictures, take videos? I'd like to know what 6 weeks, 8 weeks, 10 months later, what was the effect of that container? So one of the things that we do, we send out a survey to everybody. And this is something that Peter Van Arsdale, who was at Corbell School at University of Denver, he helped us design this survey. And it's a impact assessment to say, what was the impact of this container? And you're doing it in a place where hospitals don't necessarily keep good records of things. And, if you go into a records room, I mean, it might be, as big as a cafeteria, and it's completely full of paper. There's just charts everywhere. So it's almost impossible to figure out the statistics of how did you impact cesarean sections? How did you impact, all these different things that we would measure here, because everybody's got electronic medical records now. It's not that hard. Data's king. That's what's driving a lot of these mergers, is these companies want the data, right? Over there, it's on paper charts. So we have to figure out, how do you ask the right question to get the right answer to say, was that effort and that container effective at changing those people's healthcare? Because you can't just count how many containers you go in. You really need to say, okay, we sent you an ultrasound machine. What happened? How many people did you treat? Are there any stories, right? Because the anecdote is important. Are there any stories about things like that wheelchair that would help us to understand that we made a really big difference in that community over there? Otherwise, if you're not making a difference, stop.
Do you have do you use like a third-party evaluator? Do you have somebody on your team that does evaluations and tracks not just outputs, but also is tracking outcomes?
Yeah, we do it all in-house. If our partner has, the funding partner, if they've got enough money, and this might be a big corporation like Newmont Mining, for example, is a great partner of ours. There's other mining companies. Chevron is an oil and gas company that is a good partner, Project C.U.R.E, and there's a bunch of them. I hesitate to say one or two, but these companies are great. And they say, we're really interested in the outcomes, because they're responsible to their board about how did you invest your corporate social responsibility resources. And they're looking at it as an ROI. So they will actually help underwrite another trip. So we do the needs assessment on the front end. Then they'll send somebody back in maybe 6 months after the container arrived with a whole list of questions. We're going to take pictures. We're going to find out, and then we're going to document what happened after the arrival of that container in that community. So like in Ghana used to be called the Gold Coast, and the country name now is Ghana. It's next door to the Ivory Coast. Anyway, so there's a lot of gold mining companies, right? And they show up on site. It takes years of exploration and starting to dig before you ever make any money. But the community is broken. The hospital doesn't work. So your mine foreman gets hurt. There's no x-ray machine. Or his wife goes into labor and it's a bad outcome and he loses his wife and his baby. What will happen is they'll go in and say, we want to invest in this community. So, hey, Project C.U.R.E, why don't you come in and rebuild that hospital? Put all the stuff in there. Well, now when the mine foreman gets hurt, there's an x-ray machine. When his wife goes into labor, there's a delivery table and there's an incubator and there's oxygen and there's all the things that we need to keep that. Well, there's no better place for that company to spend their corporate resource CRM dollars than that. Because, now it is a rising tide. And these companies will do that before they ever start making money, which is pretty cool, It
makes a lot of sense, though.
But they do want to know, where did you spend that money? And what did you do with our dollars to show me? Don't just tell me a couple of stories. Show me what you did. So that's our measurement and evaluation process, starting with the needs assessment, going through the outcomes assessment, and then all of that data and those statistics. And then we have to invent the questions.
Got it. Now, do you give impact reports at the end of the year to your major donors?
Yes, and I think we could do better at that. Honestly, that's something that I'm really committed to doing. In fact, we just did a sort of an internal reorganization at Project C.U.R.E to make the data collection on all fronts a lot more robust and a lot more accessible. So for us, we're using Microsoft with Power BI. And the idea is that you would have a dashboard. And at any point in time, you call up your thing and you got the dashboard. How many of our projects are on time and how many of them are running late? How close did we get to their needs list for the needs assessment? What did we actually do when we got in and we saw 600 to 700 people at that clinic? How did that make an impact? How many nurses do we, and start quantifying that, but don't do it so that, in fact, we were having this conversation. If you came to me and you said, I'm really hungry, I could point you in two directions. There's a restaurant, there's a grocery store. Well, that's a completely different experience. Both of them have food. And we do the same thing with data, right? Mm-hmm. The restaurant says, here's your spaghetti. Would you like another glass of wine? I'm bringing it to you and it's already done. Just dig in. That's what we want our data to be. I'm going to bring you the reports. They're already done. You don't have to. The problem is a lot of organizations, and for-profit, not-for-profit, they send people to the grocery store.
Yep.
They say, well, the data's in there. Go find it. Well, I don't know. Is it spaghetti on aisle 6 with canned foods, right? Chef Boyardee, or is it in the Italian section? And where do I get do I have to start with produce and tomatoes, or can I just buy the jar? It's a problem. Mm-hmm. And it's a problem with organizations that manage data that same way, because we send people in all different, well, just go look for it. It's out there. Well, no, it's our responsibility to bring it together, put it in a cogent thing. It's the analysis of the data that matters more than the collection. Right? Fitbit. This thing keeps so much data.
Yep.
But I depend on my app on my phone to tell me what that data means.
That's right.
Right. And it's the same thing for us. We've got to do that.
I love how you put that. When I did impact reports, the companies really appreciated it. Many times they would take it and just put it right into their newsletter because they're overworked,
right,
and at capacity. And so you just make it easy for them. When it comes to who are they going to sponsor or give support to, they're going to go, who made it easy on me to tell the story of our impact? Right. And so I think that it's a key component to fundraising for sure.
Well, if a executive director of a nonprofit just did this one little thing and they just shift their mindset to say, everybody out there is a customer. My donor is a customer, right? What customer service can I do? What would my donor like to see? Those corporate sponsors, the GIK donors, those are customers. What would they like to see? Like you said, okay, customer analysis would say they're really overworked. What's really meaningful to them? Can I provide what I'm going to give to you in a way that would make sense? Almost like, a fine tailored suit or a custom meal or whatever it is. Can I do this for you so that it takes care of you?
Exactly.
Right? Our volunteers are the same thing, right? People, GuideStar, Charity Navigator, they have customers. So why wouldn't I make it easy on them to serve their customers? I've never really thought about Charity Navigator as a customer, but maybe they kind of are. And if you change your mindset about that, wouldn't that be different? What would you do different on a day-to-day basis if your volunteers were actually your customers and I'm here to serve you, as opposed to, here, go get me another cup of coffee, right?
Oh, that's brilliant. Brilliant. Love that. You've worked in both the academic and nonprofit sectors. And how do you think your background in law and finance and business administration shaped your approach to nonprofit leadership?
Well, law school changes the way you think about everything. I wish everybody would go to law school. There'd be a lot less lawsuits if everybody was a lawyer, right? You wouldn't pick fights with somebody if you knew what was coming out the other end. I don't use it that much. I do use the difference, the analysis. You train your brain to start asking questions instead of giving answers. That's the whole first-year methodology of law school. Finance is a little bit different because at the root of finance is this idea of other people's money. Use capital, which is money from them, to build your business. Well, I just said we can't do that in the nonprofit. So a lot of that doesn't have anything to do with anything, right? I can't go get a loan. I can't sell bonds. I can't sell equity. So show me a business in Denver that's really successful that funds the entire thing, organic growth from their profits. Nobody does that, right? We do. We have to. So that part about nonprofit is different. The thing that cracks me up all the time is people from the for-profit side come and say, well, we want to teach you how to run your nonprofit like a business. And I appreciate the spirit behind that, but I'm like, we've got both of our arms handcuffed behind our back.
Yeah.
Which one of those nonprofits would you like to take the salary of your executive director or your president and publish it on the web where everybody can go see it? And, I wouldn't do that. Well, we have to.
Yep.
So it's kind of tough, But the other side of it is, I didn't really think about, this is the way nonprofits do things and this is the way for-profits do things. I just showed up and said, this is the way a good business is run. And that's the way we created Project C.U.R.E. I didn't know any different. When I was in academics, first of all, it was boring as heck. I loved the students. Wasn't much fun. Wasn't much of a fan of the administration, and I hated grading papers. But other than that, it was a really great job. But even there, I taught finance, and I taught corporate law. And so even that, you look at this big academic institution, it's a business. You got to get more students in here and you've seen a lot of these colleges go out of business because they forgot who pays the bills.
That's right.
It's people getting an education. So anyway.
Yeah, no, I love it. I just was thinking, I got to think that your background really set you up to be successful because many times people that get into nonprofits don't have business background and they forget they actually should run it like a business, right? It is a business, and
that's okay. But if that's a deficit, then you need to.
That's true.
Bring somebody alongside that can do that because we can't all do everything. I mean,
that's
it's just so figure out where your weak point is and use that to be your greatest strength by bringing somebody on to take care of that. Right?
I love that. That's what I did. I was shy and I'm, an introvert. And so I didn't want to be the ones that did the tours and be front and center. So I actually ended up with the most amazing employee who was with me the entire time. And she just shines. And people are like, why aren't you doing that? I said, well, I don't need to.
Right. Exactly.
I don't enjoy that. And I've got this rock star here that is, you couldn't be better than. She's like, I wish you could duplicate her, honestly, and put her in every nonprofit. But yeah, that's so key is you're not going to have all the answers and you're not going to have all the skills. But thinking of skills, I'm curious, have you started to use AI at all?
Yeah, we're looking at it. Before we get into that, though, let me just compliment you on what you built, because you really built a very cool thing.
Oh, thank you.
And I know a lot of people who have been to those events that you did, and
Thank
it
you.
was neat. It was really cool. You had all the Broncos wives there, and
Oh, yeah. Barb Payton's a dear friend.
Yeah.
Her husband is the general manager.
Yeah.
And yeah, definitely had a lot of luck with having Broncos players and their wives involved, and your beautiful girlfriend involved as well. She's a beast. I would love to have her on the podcast in the future.
Yeah.
So if you could kind of
Put in a word.
Yeah, put in a word for me. I think she would be outstanding.
Fun.
But yeah, I just, I think we're part of the mutual fan club because I am just amazed by all that you have accomplished.
Well, thank you.
You know, as we're wrapping up here, and you've offered such great advice, I'm curious of what was one of the best pieces of advice you ever received from a nonprofit leader?
Oh, wow. I think that's a really great question, because I've gotten a bunch of advice from a lot of people.
I remember myself, I went to the conference, the nonprofit conference, and I think the first thing they did, they pulled us all in a room together, and they start by saying, "Plagiarism rocks."
Oh, funny.
And I thought, love that, right?
Yep.
Like, if they're doing it well,
Yep.
like, do the same thing.
Right. Yeah, you're absolutely right. Yeah, I don't know if it was advice, but I do remember the day, and this is kind of a fun story. Don Miller was the president of Gates Rubber Company here in Denver. And there was a big company called J.D. Edwards, and one of the co-founders was a guy named Greg Dixon. And J.D. Edwards became PeopleSoft and was sold to Oracle. And so these people were, titans of industry. I mean, they're everybody, household name. And they were volunteering at Project C.U.R.E. And I remember we were unloading a truck or something, I can't remember, and I'm looking around and I thought, in a parallel universe, I would pull all the teeth out of my head to go to work for either one of these guys for one day. I mean, they were great business leaders. They were great humanitarians. They had big hearts. And here they are in our warehouse volunteering. And it was one of those moments of stewardship where it's just like, wow. I mean, this is just incredible that I get to be a steward over those people's resources when, on paper, it ought to be completely opposite, 180-degree opposite. I should be the one begging them for a job, right? And here they are working in the warehouse. And it was just one of those neat things that you just said, create an atmosphere where anybody can plug in and everybody can be involved. Not everybody wants to be, but if you can do that, that's a pretty cool thing.
Mm-hmm. Yeah, I love that. I just felt like it was such a blessing and a gift every day that I got to be surrounded by the best of mankind. Mm-hmm. You think about all the jobs that are out there, and when you are passionate, and you get to be around other passionate people who want to give of themselves to help serve others. Like, I just was like, I don't know. How was your day? My day, it was long. We had some struggles, but I met this fabulous person and this person. And I've been able to make such good friends from these incredible people.
That's right.
Yeah, just really, really enjoy it. Well, I've loved having you here today.
Thank you.
I'd love for you to say where they can go and find out more information about your charity.
Yeah, thank you. It's www.projectcure.org.
Perfect.
My daughter always tells me, Dad, you don't have to say the www anymore. But anyways, projectcure.org.
That's awesome.
Yeah.
Well, I'm just so impressed and proud to have you on here.
Thank you.
I didn't get to even half of my questions, and so I think I'm going to have you on again in the future.
That sounds great.
All right.
Well, thanks for having me.
Thank you so much.
Yeah,
I appreciate you. Thank you for joining us today on Empower Hour. I hope you're leaving with fresh inspiration and practical insights to fuel your work. Remember, every challenge you face is a stepping stone towards impact. If you found this episode helpful, please follow us and share it with others. Keep making a difference and lifting others up. And I'll see you next time.